This medication is a combination of hormones that are used to prevent pregnancy. It contains two hormones, levonorgestrel and ethinyl estradiol. In addition, there is a small amount of iron in each of the 7 inactive tablets taken during the 4th week. The inactive pills do not contain any hormones. These tablets are meant to keep you in the habit of taking 1 tablet each day and do not have enough iron to treat iron deficiency. In addition to preventing pregnancy, this medication may also make your periods more regular, decrease blood loss and painful periods, and decrease your risk of ovarian cysts. However, it does not protect against sexually transmitted diseases. To decrease your risk of infection, always use an effective barrier method, such as a latex or polyurethane condom/dental dams, during all sexual activity. Before you start taking Joyeaux 0.1 mg to 0.02 mg, 21/iron, 7, tablet contraceptives, make sure to read the patient information leaflet provided by your pharmacist. It contains important information on when to take your pills and what to do if you miss a dose. If you have any questions, ask your doctor or pharmacist. Take this medication by mouth once daily at the same time each day. Swallow the medication whole, unless your doctor directs otherwise. It's important to take the medication exactly as prescribed and not to skip any doses. If you experience vomiting or diarrhea within 4 hours after taking your tablet, follow the directions in the patient information leaflet for what to do. Vomiting or diarrhea can prevent the birth control pills from working well. If this happens, use a backup birth control method and consult your doctor or pharmacist for more details. You can take this medication after your evening meal or at bedtime to help with any stomach upset or nausea. Your pill pack contains 21 pills with active medication and 7 reminder pills with iron. Take 1 active pill once daily for 21 days in a row, followed by 1 inactive pill once daily for 7 days in a row. You should have your period during the 4th week of the cycle. If you do not get your period, consult your doctor. If you are taking certain medications that can interact with iron, ask your doctor whether you should skip the reminder pills, iron tablets, each day. If this is the first time you are using this medication, use an additional form of non-hormonal birth control for the first 7 days to prevent pregnancy until the medication has enough time to work. If you have any questions about switching from other forms of hormonal birth control to this product, consult the patient information leaflet or your doctor. Some common side effects of Joyeaux 0.1 mg to 0.02 mg, 21/iron, 7, tablet contraceptives include nausea, vomiting, headache, abdominal cramps/bloating, breast tenderness, swelling of the ankles/feet, or weight change. You may also experience vaginal bleeding between periods or missed/irregular periods, especially during the first few months of use. If any of these effects persist or worsen, it's important to inform your doctor or pharmacist promptly. If you miss 2 periods in a row, or 1 period if the pill has not been used properly, you should contact your doctor for a pregnancy test. It's crucial to remember that this medication has been prescribed because your doctor has determined that the benefits outweigh the risks of potential side effects. Many people using this medication do not experience serious side effects. It's important to monitor your blood pressure regularly while taking this medication and to inform your doctor if the results are high. Contact your doctor right away if you experience any serious side effects, such as lumps in the breast, mental/mood changes, severe stomach/abdominal pain, unusual changes in vaginal bleeding, symptoms of high blood sugar, dark urine, or yellowing of the eyes/skin. This medication may rarely cause serious, sometimes fatal, problems from blood clots, such as deep vein thrombosis, heart attack, pulmonary embolism, or stroke. Seek medical help immediately if you experience symptoms such as shortness of breath/rapid breathing, chest/jaw/left arm pain, unusual sweating, confusion, sudden dizziness/fainting, pain/swelling/warmth in the groin/calf, sudden/severe headaches, trouble speaking, weakness on one side of the body, or sudden vision changes. Although a very serious allergic reaction to this drug is rare, seek medical help right away if you notice any symptoms of a serious allergic reaction, including rash, itching/swelling, severe dizziness, or trouble breathing. These are not all the possible side effects of this medication, so if you notice any other effects, it's important to contact your doctor or pharmacist for further advice. Smoking while using Joyeaux 0.1 mg to 0.02 mg, 21/iron, 7, tablet contraceptives can increase the risk of stroke, heart attack, blood clots, and high blood pressure. This risk is higher for women over 35 years old and those who smoke. It's important not to use tobacco or smoke while taking this medication. Additionally, it's essential to keep this product out of reach of children, as accidental overdose of iron-containing products can be fatal in children younger than 6 years. If an overdose does occur, seek medical help immediately or contact a poison control center. As for the daily dosage and optimal timing, it's important to take this contraceptive pill as directed by your healthcare provider. It's best to take it at the same time every day to ensure its effectiveness. Be sure to discuss any concerns or questions with your healthcare provider to ensure you're using this medication safely and effectively. Before taking Joyeaux 0.1 mg to 0.02 mg, 21/iron, 7, tablet contraceptives, make sure to inform your doctor or pharmacist if you have any allergies to levonorgestrel, ethinyl estradiol, iron products, or any other estrogen or progestin products, as this medication may contain inactive ingredients that could cause allergic reactions or other issues. It's important to also discuss your medical history with your doctor or pharmacist, especially if you have a history of blood clots, high blood pressure, cancer, high cholesterol, depression, diabetes, heart problems, liver or kidney disease, or thyroid problems. Additionally, if you are planning to have surgery or will be bedridden for an extended period, it's crucial to inform your doctor, as these conditions may increase the risk of blood clots. It's worth noting that taking this medication may cause dark areas to appear on your face and skin, and sunlight can worsen this effect. Limiting your time in the sun, avoiding tanning booths and sun lamps, and using sunscreen and protective clothing when outdoors can help minimize this risk. If you are nearsighted or wear contact lenses, you may experience vision problems or difficulty wearing your contacts, so be sure to contact your eye doctor if these issues arise. If you decide to stop taking birth control pills, it may take longer for you to become pregnant, so it's important to consult your doctor. It's also crucial to avoid using this medication during pregnancy, and to inform your doctor immediately if you become pregnant. If you have recently given birth or had a pregnancy loss after the first 3 months, discuss with your doctor about reliable forms of birth control and when it is safe to start using birth control containing estrogen. Lastly, it's essential to consult your doctor before breastfeeding, as a small amount of this medication may pass into breast milk and could have adverse effects on a nursing infant, as well as decrease breast milk production. It's important to be aware of potential drug interactions that can affect how your medications work or increase your risk for serious side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with this contraceptive are aromatase inhibitors, fezolinetant, aspemifene, tamoxifen, tizanidine, tranexamic acid, and certain combination products used to treat chronic hepatitis C. There are also drugs that may cause hormonal birth control to work less effectively, leading to a potential increase in the risk of pregnancy. Examples include griseofulvin, modafinil, rifamycins, ritonavir, St. John's wort, drugs used to treat seizures, HIV drugs, among others. If you start any new drug, make sure to inform your doctor and discuss if you should use additional reliable birth control. It's also important to let your doctor know if you experience any new spotting or breakthrough bleeding, as these may be signs that your birth control is not working effectively. Additionally, this medication may interfere with certain lab tests, potentially causing false results. Be sure to inform lab personnel and all your doctors that you are using this medication. If someone has taken too much Joyeaux 0.1 mg to 0.02 mg, 21/iron, 7, tablet contraceptives and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call the local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. Symptoms of overdose may include severe nausea and vomiting, as well as sudden or unusual vaginal bleeding. It's important to seek help right away if you or someone you know is experiencing these symptoms. It's important not to share this medication with others. Make sure to keep all of your regular medical and lab appointments. This includes regular complete physical exams, such as blood pressure checks, breast exams, pelvic exams, and screenings for cervical cancer, pap smears. Follow your doctor's instructions for examining your breasts, and report any lumps right away. If you have any questions or need more details, be sure to consult your doctor. If you miss a dose, refer to the package for instructions. It's important to use alternative birth control methods like condoms or spermicide to avoid pregnancy. If you struggle to take your pills on time, talk to your doctor about other birth control options. When it comes to storing Joyeaux 0.1 mg to 0.02 mg, 21/iron, 7, tablet contraceptives, it's important to keep them at room temperature and away from light and moisture. Make sure to store them in a place that's not the bathroom, and always keep them out of reach of children and pets. When you no longer need this medication or it has expired, it's important to properly dispose of it. Instead of flushing it down the toilet or pouring it down the drain, it's best to consult your pharmacist or local waste disposal company for the right way to discard it. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.